This is a video about blood draw and blood cultures from central venous access devices. These are the requisite items needed. These are the items required for a simple blood draw. Explain the procedure to the patient and gather the requisite items. Perform hand hygiene and put on a clean pair of gloves. Connect the Vacutainer needle to the holder. Prepare a 20 ml syringe with normal saline and another syringe with heparin saline of 50 units. Clean the needleless connector 10 times. Put a clean gauze underneath the needleless connector. Using a 5 ml syringe, aspirate the first 5 ml of blood. Discard this. Remember to clamp the needleless connector. Connect the Vacutainer as shown to the needleless connector. Remember to unclamp the tubing and push in the Vacutainer sample tube to draw the sample. Clamp the tubing once you're done with the sample draw. Remove the Vacutainer as shown and clean the needleless connector again. Flush in at least 10 to 20 ml of normal saline. At the last 1 ml, clamp the tubing. Now perform a hep lock with the heparin saline as shown. Stop at the last 1 ml and clamp. Clean the needleless connector again to finish up. These are the items required for a blood culture draw. Explain the procedure to the patient, perform hand hygiene and put on a pair of sterile gloves. Prepare a needleless connector and prime it as shown. Using a no-touch technique as shown, clean the needleless connector. Clean from the needleless connector upwards to the tubing. Put a sterile drape as shown. Attach a 20 ml syringe and take the required volume for the blood culture draw. Take the syringe and connect to a sterile transfer device. Yourself or your assistant can then proceed to fill up the blood culture bottles as shown. Remove the needleless connector and clean the tip of the tubing at least 10 times. Connect a new syringe with a new needleless connector with the normal saline for flushing. Flush at least 20 ml of normal saline. And lock at the last 1 ml as shown. Perform a HAP lock with 50 units of heparin saline and again clamp at the last 1 ml. Clean the needleless connector again. Please note that what is shown in this video at the end of each procedure is heparin saline flushing for intermittent access. In other words, these are devices that are still being regularly used. For access devices that are not being regularly used, terminal flushing with heparin sodium 500 units in 4.9 ml is performed. For a Portacath device, this is once a month.